Hello guys, how are you? I hope so that you will be fine and enjoying good health. Today I have selected a topic on Lichen Planus, which is a skin disease. So I will discuss what it is. Lichen Planus is a condition that can cause swelling and irritation in the skin, hair, nails, and mucous membranes. On the skin, Lichen Planus usually appears as purplish, itchy, flat bumps that develops over several weeks. Lichen Planus is a condition that can cause swelling and irritation in the skin, hair, nails, and mucous membranes. On the skin, lichen planus usually appears as purplish, itchy, flat bumps that develops over several weeks. In the mouth, vagina, and other areas covered by mucous membrane, lichen planus forms lacy white patches, sometimes with painful sores. Most people can manage typical mild cases of lichen planus at home without medical care. If the condition causes pain or significant itching, you may need prescription drugs. Lichen planus is not contagious. Now we will come to the symptoms. The signs and symptoms of lichen planus vary depending on the affected areas. Typical signs and symptoms are purplish, flat bumps, most often on the inner forearm, wrist, or ankle, and sometimes the genitals. Itching, blisters that break to form scabs or crust, lacy white patches in the mouth or on the lips or tongue, painful sores in the mouth or vagina, hair loss, and changes in scalp color, nail damage or loss. When to see a doctor? See your doctor if any tiny bumps or rash-like condition appears on your skin for no apparent reason, such as known allergic reaction or contact with poison ivy. Also see your doctor if you experience any signs or symptoms associated with lichen planus of the mouth, genitals, scalps, or nails. It is best to get a prompt and accurate diagnosis because a number of skin and mucosal conditions can cause lesions and discomfort. So what are the causes? Lichen planus occurs when your immune system attacks cells of the skin or mucous membranes. It's not clear why this abnormal immune response happens. The condition is not contagious. Lichen planus can be triggered by hepatitis C infection or a flu vaccine or certain pigments, chemicals, and metals, and taking pain relievers such as ibuprofen, Advil, Motrin, IB, others, and naproxen, LE, others, and certain medications for heart disease, high blood pressure, or arthritis. What are the risk factors involved? Anyone can develop lichen planus, but the condition most often affects middle-aged adults. Oral lichen planus most often affects middle-aged women. What are the complications? Lichen planus can be difficult to manage on the vulva and the vagina, causing severe pain and sometimes leaving scars. Sexual dysfunction can become a long-term complication. Oral sores may affect your ability to eat. The affected skin might stay slightly darker even after the rash clears up, especially in the dark-skinned people. Oral lichen planus increases the risk of oral cancer. Left untreated lichen planus of the ear canal may lead to hearing loss. So what is the diagnosis and treatment? Your doctor makes a diagnosis of lichen planus based on your symptoms, your medical history, a physical examination, and if necessary, the results of lab tests. These tests may include biopsy. Your doctor removes a small piece of affected tissue for examination under a microscope. The tissue is analyzed to determine whether it has the cell patterns characteristics of lichen planus. Then hepatitis C test, you may have your blood drawn to test for hepatitis C, which is a possible trigger for lichen planus. And then allergy test, your doctor may refer you to an allergic specialist or dermatologist to find out if you are allergic to something that can trigger lichen planus. So other tests may be needed if your doctor suspects you have any of the several variations of lichen planus, such as the type that affects the esophagus, genitals, ears, or mouth. Now we come to the treatment. Lichen planus on the skin often clears up on its own in months to years. If the disease affects your mucous membrane, it tends to be more resistant to treatment and prone to recur. Whenever treatment you see, you will need to visit your doctor for follow-up appointments about once a year. Medications and other treatment might help relieve itching, ease pain, and promote healing. Therapy can be challenging. Talk with your doctor to weigh the potential benefits against possible side effects of treatment. Now we come to the corticosteroid. The first choice of treatment of lichen planus is usually prescription of corticosteroid cream or ointment. If that doesn't help and your condition is severe or widespread, your doctor might suggest a corticosteroid pill or injection. Common side effects of topical corticosteroid include skin irritation or thinning where the cream is applied and oral thrush. Corticosteroids are considered safe when taken as directed and for short-term use. Then oral anti-infection drugs. Other oral medicines used in selected situations for this condition are the anti-malarial hydroxychloroquine, plaloquenil, and the antibiotic metronidazole flagyl others. Immune response medicines. Severe signs and symptoms may require prescription medication that suppresses or modify your body's immune response, such as azathioprine, Imuran, azasan, mycophenolate, Cellcept, cyclosporin, Gengraph, Sandy-Immune, others, and methotrexate, and then antihistamines, of course. An antihistamine medication taken by mouth might relieve the itching of the lichen planus. Then light therapy, phototherapy may help clear up lichen planus affecting the skin. The most common phototherapy for lichen planus uses ultraviolet B UVB light, which penetrates only the upper layer of skin epidermis. Light therapy usually requires 2 to 3 treatments a week for several weeks. This therapy is not recommended for dark skinned people who have an increased risk of skin staying slightly darker even after the rash clears up. Then retinoids. If your condition doesn't respond to corticosteroids or light therapy, your doctor might prescribe a retinoid medication taken by mouth, such as acetretin, soriatane. Retinoids can use birth defects, so these drugs are not recommended for women who are pregnant or may become pregnant. If you are pregnant or nursing, your doctor may opt to delay topical retinoid therapy or choose a different treatment. Dealing with the triggers. If your doctor suspects that your lichen planus is related to hepatitis C infection, allergies, or drug you take, you might need other treatment. For example, you may need to switch medications or avoid offending allergens. Your doctor may refer you to a allergist or, in the case of hepatitis C infection, a specialist in liver disease hepatologist for further treatments. And life therapies, home remedies, and lifestyle measures can be taken, which can reduce the itching and discomfort caused by lichen planus, and these include soaking in a bathtub with colloidal oatmeal Aveeno, followed by moisturizing lotion, applying cool compresses using an over-the-counter hydrocortisone cream or ointment containing at least 1% hydrocortisone if you are not using a prescription topical corticosteroid, avoiding scratching or injuring your skin. For oral lichen planus, good oral hygiene and regular dentist visits are important. You can help reduce the pain of mouth sores by avoiding smoking, drinking alcohol. Consuming spicy or acidic food and drink should be avoided, and alternative medicines can be applied. A course of small clinical trials have suggested the benefit of aloe vera gel for treating lichen planus of the mouth and vulva. Look into alternative medicines approaches that help reduce stress, as stress can worsen the signs and symptoms of lichen planus. Then here's some information to help you to get ready for your appointment. Before your appointment, make a list of symptoms you have been having or for a long time, and all medications, vitamin and supplement you take, including the dosage. And question to ask your doctor for lichen planus. Some basic question to ask your doctor include: what's the most likely cause of my symptoms? Are there other possible causes? Do I need any test? How long will these skin changes last? And what treatments are available and which do you recommend? What side effects can I expect from treatment? I have these other health conditions. How can I best manage them together? Are there any restrictions that I need to follow? Should I see a specialist? Is there a generic alternative to the medicine you are prescribing? Do you have any brochures or other printed material I can take with me? What website do you recommend me? What to expect from your doctor? Your doctor will be likely to ask you a number of questions, such as where on your body you have found the lesions. Are the affected areas itchy, painful, or uncomfortable? How would you describe the severity of the pain or discomfort? Mild, moderate, or severe? Have you recently started new medications? Have you recently had immunizations? Do you have any allergies, etc.? So this was all about lichen planus, and I hope so that you would have liked this video. And if you have liked this video, then don't forget to subscribe my channel and kindly share this video with other individuals as well, and have a wonderful nice day. Thank you very much.